opening the door wide to new possibilities, hope of real breakthroughs and understanding more big ideas than we could have ever imagined. These are the biggest grants we've ever been able to offer. We're going to come out of this with some breakthrough ideas.
Focused solely on neuroendocrine tumors. You are not alone. We are all with you on this.
Hello, everybody. I'd like to introduce everyone to the New York City Regional Neuroendocrine Tumor Patient Conference, co-sponsored by Montefiore Einstein Center for Cancer Care and the Neuroendocrine Tumor Research Foundation, also known as NETRF. We'll be talking about all types of things related to treatment and diagnosis of neuroendocrine cancer, and also have an opportunity for all of you to ask questions. Before we start, I'd like Ron Hollander, who's the Executive Director of the Neuroendocrine Tumor Research Foundation, to give a few remarks. Thank you.
Thank you, Dr. Wolin, and good morning to you all. And as we go through the day, and I hope to remind you about this throughout the day, there are question cards. I mean, we are here for you today to give you information, and I want to talk a little bit more about how we've got the day planned out. But if you have questions you want to ask, especially this terrific speaker panel we'll be pulling together later, please take a card, take 2 cards, take 3 cards. We'll be collecting them throughout the day, and then Dr. Wolin and I will work on trying to categorize them into groups that we can get the most information to most of your questions as possible. So that's all the housekeeping. Now we can start the tape, I guess. Thank you, Dr. Wolin, again for hosting. This is the first time we've done a patient conference here in New York, the Neuroendocrine Tumor Research Foundation, formerly known as the Caring for Carcinoid Foundation, for those of you who've been with us and following us for a long, long time. We do these conferences throughout the U.S. We're very proud of the fact that in addition to our research mission, which is focused solely on neuroendocrine tumors and solely on research that can drive better understanding, but most importantly, better treatments and cures for all forms of carcinoid or neuroendocrine cancer. We also provide information and education to our patients throughout the US and are very active globally, as you'll hear later. So this is a very... Okay, can we turn up the mic, Antonio? Great, and thank you. Thank you for the comment as well. Is that better? Yeah. Okay, terrific, terrific. So these educational programs are really an important part because, as you'll hear, as much as we know about these tumors, there's still a lot more we need to know and a lot more work that needs to be done. And so if you are new to the journey, newly diagnosed, or a family member of someone who's newly diagnosed, or if you've been on the journey for a year or 2, or I spoke to someone this morning who's with us today who's been on the journey since 1988. There's still more to learn and there's still a lot more to know. And so keeping in touch and coming to conferences like this is critical. At least online, it looked like this was the first conference for more than half of our audience. How many of you are here for the first time at a conference? Wow, okay. So for those of you watching the videotape, that was about 75% of our crowd so far. And I'm sure the ones arriving are the same category. So we have a special challenge today, which is to answer your questions, but I implore all of the speakers to try to be as clear and as reverent about defining things as possible for our patients. And by the way, thank you to our staff. In your program, there is a glossary of terms. So if you get really confused about something, some, not all of those terms are defined. It may not answer all of your questions, but again, make sure you use those cards as well. I do want to thank our sponsors because none of this would be possible without them. We do these conferences throughout the US and we get help from educational partners and their booths are out there, so please visit them. I want to thank them all. They're in the room with us here today. Novartis Pharmaceuticals, Ipsen Innovation for Patient Care, Lexicon Pharmaceuticals, as well as Net Alliance. And there's information from all of those sponsors, as well as from your local patient groups, including Big Apple Nets. And thank you very much to Emily Zuckerberg and her husband who are with us here today for really helping to spread the word. And we're so pleased to have other patient groups from the New Jersey, Connecticut, even Pennsylvania area who've been part of putting this program together as well. So visit their table, visit our table. There's other information. Again, you cannot have too much information here. It's good to really gather it while you're with us. So very special thank you to our sponsors. I also want to thank our donors, and we'll talk more about our mission later, but these are the foundations, the people, the partner organizations, many of whom you'll hear from today, that make it possible for this very special community, and it really is a community, the entire NET community of doctors and researchers and patients and caregivers and patient groups, really in a very special way working together. And for those of you who are new on the journey, take some comfort in that. You are not alone. And by the end of the day, you are going to be joined to resources, to speakers, to other patients and caregivers. Make use of those networks. We are here for you. We are on this journey together. So I heard it was a first-time conference for many of you. How many of you, for those who either are patients or family members, are newly diagnosed? How many have been diagnosed in the last year or two? Okay. How about 2 or more years? Okay, a large group. How about 5 or more years? Okay, that's about, I'd say about 15, 20%. Okay, so for all of you, how long was it before you were diagnosed from when you first started having symptoms? Let's say more than 2 years. Well, let's do it the other way. More than 5 years. Okay, so that's about 10% of our group. More than 3 years? Okay, and for the rest of you, fairly short, so more like 1 and 2 years. Okay, well that's, quite frankly, good to know, because the time to diagnosis in this area, as you'll hear later, has often been much longer than that. So kudos to all of you and the resources in this tri-state area that you've at least learned a little bit more about the diagnosis, because that's terribly important too. So our founder was a patient, a young woman who had been, like so many, misdiagnosed for a long, long time. And by the time she was diagnosed, had metastatic disease, as many have, and I'm sure some of you. And I talk to patients and families pretty much every day about those journeys. And one of the things they all ask about is, why don't we know more about these diseases? Why isn't there more information? Why don't my own doctors know more about it? And what causes them? Where's the research? Where are the treatments that I know exist for other cancers but don't exist here? That's the purpose of doing these kinds of conferences, to inform you, to really empower you with information so you can access the experts we're here today with, the information you need, the connections with patient groups and others that can really make a difference. We want to arm you with that information. We hope you take advantage of the breaks to connect with each other as well. And you're going to hear from some amazing experts today. You're going to hear from some terrific partners today. We are all with you on the journey.